I appreciate each one of the doctors that they played a role because they kept me stable. They kept me with hope. Like I said, they kept me with hope, and they kept me moving forward.
Moving forward while getting breast cancer treatment, only to learn she had a second cancer. We meet one patient who is grateful she sought a second opinion. And good morning, happy Friday. I'm Jessica Lovell and welcome to the Morning Medical Update. Yolanda Irvin is now a strong believer in the power of a second opinion. It's what led her here to the University of Kansas Cancer Center and what she calls her incredible team of doctors. That team saved her life, allowing her to pursue her new mission in life.
When you ask Yolanda Irvin the reason for sharing her story, it's simple.
The Lord directed me and woke me up that morning and said, He's going to give me a platform to give a testimony of my care that I received at this hospital.
After 2 years and 2 back-to-back bouts with cancer, Yolanda is back to living and working the job she loves at the front desk of Brookside Charter School.
Thank you for calling Brookside Charter. This is Ms. Irvin. How can I help you today?
She truly sets the tone. The energy is positive. She always has a beautiful smile on her face.
She and her husband, Clyde, a local pastor, are ready to share a list of thank yous a mile long.
Dr. Khan, who was my breast cancer doctor, he never made me feel like I didn't have an opportunity to survive. Dr. Wagner, oh my God, she made me laugh. And so when you're going through cancer, sometimes you don't feel like you can laugh.
The doctors, the nurses, the staff, and even down to the custodians that would come in and clean the room, they were all awesome.
And Dr. Casapouls was one of my favorites. Dr. Kasi was very professional, but he was very touchable too. They kept me with hope, and they kept me moving forward.
It took her a while to reach her beloved team at the Cancer Center. When Yolanda was first diagnosed with breast cancer, she was getting her care elsewhere.
In my community, a lot of people don't know the power of a second opinion. My daughter and my family said, let's get a second opinion, and let's go for the best.
Switching to the University of Kansas Cancer Center was a decision Yolanda believes saved her life.
They had better equipment. They were actually able to pinpoint my diagnosis. They did not hesitate to get me into every particular test that I needed promptly.
But in the middle of her breast cancer treatment, Yolanda would be dealt a stunning blow.
It was a definite 1-2 punch.
Unrelated to the breast cancer, she also had stomach cancer.
No one really knows what it feels like when you get cancer, but then to be told you got another cancer that's not even related, it can be so mind-boggling. Well, I didn't blame God, but I had a few questions.
She stayed the course with her treatments. Her final surgery, August 26, 2022. Yolanda is now cancer-free, and she has a new mission, helping others traveling the same journey she just navigated.
But I want to be able to have an area in the inner city community. When patients are going through cancer, there's a lot of small things that are overlooked. One of the things that's overlooked is, what am I going to fix for my children for dinner today? I want to go to my appointment, but I don't have anybody to drive me there. So sometimes it's very difficult.
Oh man, it's a God thing. She is one of the most motivating people that you will ever meet.
Speaking of God, Yolanda says she no longer asks him why she got cancer twice. She knows it was a catalyst leading her to this next mission.
Miss Yolanda, how are you today?
I'm doing good. How are you?
Oh, I'm so good, and we're just excited to have you today. We're going to hear more about your mission and your story, so hang tight. I know you have a lot of great things to say about your providers here, and we got 2 of them with us. Dr. Mazen Alkas-Pools, he is a surgical oncologist focused on the GI system, and in this case, it was Yolanda's stomach cancer, so we're going to talk about that.
Okay.
Okay, and then Dr. Jamie Wagner, breast surgeon, who helped treat Yolanda's breast cancer. I know she's very excited to see you both, and I know you guys feel the same, right?
Oh, yeah, absolutely.
Yeah.
Hi. Hi.
Good morning.
Good morning.
All right, Yolanda, before we get started, tell us about the shirt.
This is my favorite television. It's called my television shirt. I looked for hours to find it. I wore it when I was on Wheel of Fortune. I wore it when I went to Price is Right. This is my television shirt. So they asked me what I was going to wear today, I had no problem telling them what I was going to wear today.
All right, 3 times a charm. Okay, so we're coming right behind the prices, right?
Right
behind.
I'll take that.
Pat Sajak. Okay, we'll do our best. We're happy to be with you today, and you look gorgeous. Most importantly, though, besides that shirt, Yolanda, you're now cancer-free. Take us back.
Yeah.
How did you feel, though, when you were first diagnosed with cancer, when you first heard the C word?
The first thing I thought was, and I'm going to be honest with you, first thing I thought is I'm going to die. And then the next thing I thought was I'm going to live. I'm writing a book entitled The Cancer Draft. And I was raised in Anchorage, Alaska. And when I was there, on our TV screen when I was a little girl, there was a little number up in the corner of the TV screen. And I asked my mother, what is that number? She said, that's the draft. When people have to go to the Army, there's a little number up there and you're supposed to report. Well, I didn't understand it fully, but that's the way I felt about when I received the news that I had cancer, that so many other people that I knew and that I loved had been dealt that card. And now it was my turn. Just like it was their turn to go to the service, now it was my turn to go through that battle.
Yeah, your turn to step up to the plate and make a difference, which is what you're doing now. Tell us, though, how you were first diagnosed with cancer. Yolanda, did you feel a lump? What did you notice?
I actually had kind of bumped my right side one day at work. And so I just thought I had just developed a little bump there because of that. And actually, my husband, who was in stage 4 colon cancer at the time, it was also the day that we actually closed the country down. COVID made it difficult for me to go to the doctor for my regular mammogram. So I just did not go. And I waited that whole year and took care of my husband and just stayed in with COVID. But I noticed that it didn't go away. So the next opportunity that came up for me to go to have my breast exam, I went in. And then I didn't have any question when they said, we noticed something in your right breast. And I said, it's right here, isn't it? And they said, yes. And that's how I actually found out.
Well, and Yolanda, and we'll talk with Dr. Wagner about that, but this is something that's concerned her all along with COVID, is that people were putting their screenings off because of the pandemic and coming in a year later. Right. And so, but through all of this, your family actually pushed you to get a second opinion before you came here. What did you know about the health system before you came through the doors?
Well, I hope you don't edit this part, but I thought that KU Hospital, that's what we called it back then, the University of Kansas Health System now, I thought it was for only the rich. I thought you had to be a certain color, gender. They were only going to test you. They weren't going to really help cure you. My community just didn't think that this hospital was attainable or that we could get a second opinion. I did it. I took what the doctor said and I went with it. It was my community hospital. But I didn't have a clue that I could go outside of my community, outside of my environment, and check out a hospital that had a specialty in cancer. I just didn't believe it. So that's what I thought. I thought I wasn't able to go to a hospital like that. I call the University of Kansas Health System, I call them a metropolis. They are huge. And I watched them grow. So why shouldn't I be able to go? I think I can make that an acronym.
Yeah, I think you could. Yolanda, this show is live, so there's no editing. And I never in a million years would I edit that out. That's one of the most powerful things we've heard here on this program. And I want to bring in your doctors because I looked over at them to imagine that someone like this woman sitting here with us today thinks that she doesn't belong here, that she wouldn't have access to us. Jamie, what's it like to see her here with us today?
Oh my gosh, she is just a beautiful joy to see. The way she proceeded through her entire journeys, because she's had to, as you were just describing, is with poise and grace. And I absolutely know that her faith was a very strong part of that, which I enjoyed really having the opportunity to help her through that journey.
So let's dig in, because you brought some images of her mammograms. Let's see what those look like. What were you looking at, and then what were you able to tell her?
Well, through our process, and this is really what we do as an NCI designated cancer center for the breast program, is we evaluate outside images, and then anything that we might want some clarity on, we obtain a few more. And that's really what we're seeing here is we did see the biopsy spot, and that prominent white in the middle is the biopsy clip that she had from the outside institution. But we saw a lot more asymmetry within the breast that brought some concern. Said maybe we should do a little bit more imaging. So that's really what that first picture was. And then this is the ultrasound. And we saw a mass that had not been biopsied. And so that was really what we felt needed additional workup, because it can make a really big difference, as what we saw in Yolanda's case. We proceeded with getting an MRI, and what you're seeing on the left really is the fact that there was a lot more going on, much more extensive than what had originally been remarked on. But the right picture, I think, is the wonderful part. That is her MRI after she had completed chemotherapy, and she had such a fantastic response. And this is really, I think, demonstrating what she commented on, the advances we have made across all of cancer, but it includes imaging. And we have phenomenal, specially trained, fellowship trained breast imagers here, breast radiologists, but it's also the policies, the protocols that go into how we use that more advanced equipment, and really staying at the forefront of anything new that's coming out. So we want that for our patients.
And does that advanced equipment and technology help when you have advanced cancers? And in this case with Yolanda, she said it, and you've heard this, and this is your fear, is that people, and Dr. Kaz, I know the same thing with you, is that people were going to put off their screenings because they didn't want to be out and about during this pandemic. How important, though, did that come in when you're talking about the screening and the technology used?
Well, just for all patients, advanced cancer or early stage breast cancer, the advances that we have made in imaging continue to play a part. We recognize now that dense breast tissue is something that we really need to be evaluating on patients, and the broadening of the modalities that we have available in breast imaging allows us to look differently at the breast and the breast tissue to identify and meaningful cancer.
So chemo treatment, and you said she responded very, very well to it.
She did, yeah.
So Yolanda, here's your moment. I'm going to let you have at it. Dr. Wagner's here. What was it like working with her?
She made me laugh. I put down all the things that the doctors were. They were confident, polite, they listened to me, they praised me for my progress, they watched signs of changes in my body, they had a genuine hope for my future in their eyes. I could see it. People, you look in people's eyes, you can say, oh, she's not telling me the truth, he's not telling me the truth. But each one of them had something different that they added to me. And one of them was Dr. Wagner, was laughter. When I walked into her office the very first time, scared that my breasts were going to look different. I had no idea. Now I'm 64. I was just glad I still had them. But the thing about it was I was married 43 years and I wanted them to look pretty similar. And so Dr. Wagner, the first thing she made me laugh about with my husband there, because he was at every appointment, she said, Miss Irvin, I said, Dr. Wagner, I need you to do this. Can you make it look this way? Can you, after you take out all this, what's going to happen over here? It's going to be imbalanced. She stopped me midstream. She said, Miss Irvin. I said, yes. She said, I got this. She said, don't worry. I got this. She looked over at my husband like, tell her. And he looked at me and said, she said she got this. So why are you worried? And I just bust out laughing and said, yes, ma'am, you got it. Do what you need to do. Do on both of them. Hey, if you got it, you got it. And that's the best. He gave me laughter.
And that's the best thing to hear from someone. Something as simple as, I got this. I got this. You're smiling. What's it like to hear from her and know how happy she is?
I think if anything, I'm very humbled that this has been her experience. And I know that we talked a lot about faith actually during some of our conversations, and she knows very well that I firmly believe that this was my calling from God, is to be a breast surgical oncologist and help shepherd my patients through this. But most importantly is being at the forefront all the time so that they are getting the very best care that they could get anywhere in this world. And I just so thrilled that was what her experience was.
It's a good way to end a week, isn't it? This
Right,
is a good Friday
I know.
chat to have Miss Yolanda with us today. Dr. Caspoles, we'll get with you in just one second. I have one more question for Dr. Wagner. And Yolanda had touched on this because we know that there are health disparities when it comes to communities of color, especially with breast cancer. We know that African American women tend to have higher advanced rates of breast cancer. Again, it goes back to why screening is so important. But how are we combating this? How are we approaching this in clinic?
I mean, it's a huge problem, and we recognize that. I think recognizing it is first and foremost, and really trying to socialize and get word out. And that's where I think advocates like Yolanda will help us, I hope, in the future really move forward in just getting the word out that we are here for everybody. And also with that, I think what is very important is to recognize some of the things you said is those people who don't think that they have the right to be here are exactly the people that need to be here. They have the more advanced cancers. They need the clinical trials. They need the higher levels of therapy that we offer. And in our minds, there's no disparity. Like we want to take care of all patients. Access is absolutely part of it. It's not just their perspective of if they should be here or not. Part of it is just the challenges of them physically getting here. Sure. And that is what I know I particularly in my areas of research have a strong passion for figuring out how do we overcome that. And using technology that we have today as maybe another tool to help do that.
It's the barriers that were here 20, 30, 40 years ago. We're starting to break those down. And
That's
they're
right.
actual real barriers, like not being able to actually physically get here, right, Yolanda?
Yes, because that is actually what caused me to come to KU Hospital. I felt like I had something to offer, and I knew God was directing me because he woke me up that day and he said, go to KU, go to the top and let them know. He said to me, you'll have a platform. And I didn't understand it then, but I do now. Some people don't feel like they have the right to a second opinion because they can't get there. So I said, there's somebody out there that'll say, here's a couple of vans. You go out and get people and you bring them yourself. You pick them up. Some may say, I wanted to come, but I didn't have anybody to watch my baby. So I just went to the one that's close for me to get to on the bus line. Well, no, maybe you'll pick them up. Maybe you'll have someone that can watch the children or a place where we can take you, drop off your child for a few hours, your infusion, whatever. The Hope Center, I hope to one day get a sponsor for the Hope Center that will be centered out of our building that we have that's almost abandoned. But I want people to be able to know about the hospital, know about a second opinion, but don't just know about it. What am I going to do to get them there? What organizations am I going to go to help them to get to the place where they can get help? I've lost friends because they were not able to get to where they needed to get to. So, hey, I got a lot of work to do. I'm telling you, University of Kansas Health System, you got your girl. I'll go in the community. I'll do it. I will do it.
We have no doubt. We have no doubt. We're putting a lot of this on your shoulders, and I think you're going to carry us through, Yolanda. You were laughing alongside Dr. Wagner, and she was keeping you up through breast cancer. But then you stop laughing because then you find out you have stomach cancer as well. I want to bring in Dr. Caspoles and tell us a little bit about when you met Yolanda and the challenge of having someone who is now dealing with breast cancer and now they're your patient.
Yeah, I mean, her situation was very unique. It was interesting, actually. She had some bleeding that was noted, and it turns out she had a cancer of the stomach. Now, the interesting thing about her situation is that she didn't have the typical stomach cancer. She had a rare type of stomach cancer. It's actually a cancer that can start in any part of the GI tract. It just turns out that it began in the stomach for her. And I think the value of coming to a place like KU, an academic center, is we have a lot of experience in that type of cancer. And so it's not just me, obviously. The medical oncologists, others. We realized when I met her that the cancer that was in her stomach, which again is rarer, actually had a more favorable outlook. It was easier to treat because it was in its earliest phases, and it's not as aggressive as the other stomach cancer. Which
so
is
it worked
kind
to
of,
her benefit and to your benefit in treatment.
Yes. So knowing what we knew about her cancer, which is called a GIST, which is gastrointestinal stromal tumor, what we knew about that told us that we should focus more on her breast cancer at the time than the other cancer. It's not that we couldn't treat the other cancer. We could. We have medications to treat her with. But in terms of the surgery part of it, we realized, or even the chemotherapy part, we realized that type of cancer trumped what she had, which was more favorable. So you have to make a decision, like which one are we going to focus on first? Yeah.
So not often do we see the breast oncologist teaming up with the GI oncologist and talking and communicating with each other. What was that like to collaborate and to figure out the best route?
Yeah, I mean, we communicated, a lot of it was done actually through email, but yeah, I mean, we just discussed this, and I think we both knew, because Dr. Wagner has experience in the GI cancer that she had as well. So we knew what path needed to be taken. So once she had finished sort of the breast part of it, the breast cancer part, that's when I became involved, and I removed the cancer that was in her stomach. And actually, it turns out, again, typical stomach cancer is 8 times more common than what she had. But it turns out that even the surgical approach to this more rare cancer is easier. You don't have to remove as much stomach. It's not as elaborate as an operation. And all these things, I think, come with experience. Not every place understands these types of tumors and how aggressive they are. So knowing what we knew about GIST, the tumor she had, I think really made a difference. And I think Yolanda is an amazing person. I mean, it's just, the great thing about Yolanda is what people don't realize is that it's the attitude and the outlook has such a huge advantage than people think. It actually, studies show that outcomes are better, and also your psychology is better when you have a more positive outlook. So when I talked to her and explained these things to her, I think, it just I noticed it settled her down. She understood what was happening.
Because you said she was very fearful.
Yeah, she was very, very fearful. I mean, it's scary. You got stomach cancer. Yeah, but it's not that kind of stomach cancer. So we got this. Just like Dr. Wagner said, although I didn't use those words, but I basically said, we can do this. We just have to take our time, take a step back, and move forward.
All right, Yolanda, it's your turn with Dr. Alcas-Pouls. Let him have it. What do you want to say to him?
Dr. Alcas-Pouls, I really appreciate you because you were my word of stability. That's what I put in my heart. When I was diagnosed with breast cancer, I thought, okay, I'm going to do this. But I had a GI bleed. And what Dr. Alcas-Pouls didn't share is that I was in the hospital for almost 2 weeks with that GI bleed. And when they came in and told me about the cancer while I was in KU Hospital, Dr. Alcas-Pouls came in, and I was sitting in a chair, I believe, beside the bed trying to recover and get my strength back. And Dr. Alcas-Pouls is not a real tall man, but he came down to my level.
Go ahead and say it, it's okay.
He came down to my level. He came and knelt on one knee beside me, and my head was down, so I really was looking at him but not looking at him. And he came and got on one knee on the side of the chair, and he said, Miss Irvin, he said, you're going to be okay. You're going to make it. We got this. Let's handle this first, and then we're going to deal with this. That stable word told me that he believed that I was going to overcome that. I was going to get better, and then it would be his turn. And that stabilized me. All while I was in breast cancer, all while I was in surgery, radiation, chemo, it stabilized me. That Dr. Alcas-Pouls said, you're going to get through this, and then we'll get to the other part. So he stabilized me. He told me each area that I was going to go through and what he was going to do. He drew the picture on my board in my room, and everyone that came in my room to visit me, and this was even during COVID, I pointed to the picture. I said, my doctor drew that picture. He showed me what he was going to do, and this is going to be my outcome. It's going to be good. He was my stable word. And I thank him for that. I thank him for that.
You're welcome, but thank you. I don't realize how much I don't think a lot of patients don't get how much we get out of this, you know, and you know, KU, I mean, the reason we like working at the university or any academic program like a university is we actually enjoy the diversity of patients that come. I don't think people realize that. We often take a job like this because we want that. You know, we want the diversity. It's really important to us. And I don't think most patients understand that.
Yeah, that's really good point.
That's why my job is going to be that. That's going to be my job.
Right alongside that.
Later and say, that's her job. That's her calling.
Absolutely. All right, if you have questions for Yolanda or our doctors, go ahead and send those in to YouTube, Facebook. You could tweet us or send them to the Medical News Network. Info is there on your screen. Guess what? Dr. Hawkinson is gone, so he's going to let me do the COVID count today. I'm going to see if I can get this straight. So we have 20 total patients, 7 with active infections, 0 in the ICU, 0 on ventilators. So I'm happy to say that and report that news today. Any reporters with us? Okay, let's get to some community questions because we've got some good ones. Casey wants to know a little bit more about Yolanda's mission in her community. Where do we stand? What do you plan on doing? What's the plan of action, Yolanda?
Well, we have a building that is an old building, but it is right in the center of the city. The city has like what they call 7 worst blocks of the city. And this building that we had for a church years ago is still sitting on that block. We want to renovate that building and have it be a center where people can come and they can actually sign up for assistance. They can call in. It's going to be called the Hope Center. And the Hope will stand for healing opportunities for people everywhere. That's the key word, everywhere. And in my community, we want to bring knowledge of the hospital to my community. They need to know. So that will actually be where we will start. We will provide transportation to help them get there. We will actually be able to help them in any area of support. Some people just need flowers. Well, there's a flower company out there that says my flowers are good at the end of the day and I'll just give them to you. And we'll turn right around and just give them to someone who's going through cancer who may not have a support system to even bring them a flower. It was COVID when my husband had cancer, and someone delivered flowers to my home once a week. And it changed the tone of me. When I had to prepare food for him, when I had to take care of him, the flowers were there and they meant a lot. So a lot of things like that will be done out of the Hope Center. Healing opportunities for people everywhere, especially in my community, so that they learn more about the hospital and what they have to give.
Love it. Couple more questions. Jackie wants to know if someone has one cancer, does that automatically put them at a higher risk of developing a second cancer? Who wants to grab that?
The answer is yes. I mean, it does. I mean, if you, you know, we've had patients that have had like 4 or 5 cancers, you know, and even more. And, you know, if you can get them through all of it, they can live long lives. But the answer is yes. It does. Your chance of having another cancer does increase, and that's been shown. Yeah.
Rick wants to know what's the follow-up care for Yolanda, Dr. Wagner?
So she is still actually within her first 5 years, so she has quite routine follow-up with from the breast cancer side with myself and Dr. Khan from the breast medical oncology side of things. Because she was fortunately able to preserve her breast as a result of her treatment, she continues screening mammograms. I get this question a lot, is after you have that first mammogram after your cancer treatment, do I need more mammograms? Do I need them more frequent? Do I need to have MRIs all the time? And you don't. We take each person and tailor it to them. Sometimes it's their cancer, sometimes it is their age at diagnosis, sometimes it's their breast density. All of that needs to be taken into consideration. But in general, once you get through your cancer treatment, you just go back to annual screening mammograms. And then whatever supplemental screening, whether it be ultrasound or MRI, that should be coupled with that, we also make sure that they're on that right timeline.
Dr. Wagner, I'm going to stick with you right now. What do you want the takeaway from today's conversation to be?
One, Yolanda's mission is amazing, her heart and passion. But what she's actually bringing up is something that I equally have a passion for, is we are here for everyone. And like Dr. Alcaspools just said, we love the diversity. That's why we're an academic institution. You know, equally, studies are showing us right now that when we do clinical trials, and we do amazing clinical trials through our cancer center here, but across the country, the clinical trials outcomes are being underrepresented by the disparities that we see, and that goes to access. And we want to advance cancer across the board, and so we want to be here. We're recognizing it, and please come, because the second opinion makes such a difference. In breast cancer specifically, we know that when patients get a second opinion at an NCI designated cancer center, their diagnosis and treatment can change as often as 43% of the time.
Those numbers are big.
Very big. And that was Yolanda's case, is by having this, she had a stage 0 cancer when she came to us, and ended up very dramatically from that second biopsy having a very aggressive type of cancer that was so successfully treated because she got the right diagnosis at the beginning.
Dr. Alcaz, final thoughts?
Yeah, again, it's more focused on Yolanda. You know, the interesting thing is, you know, we try to guess what the community needs, but the most of us that work at a hospital, you know, we don't come from those communities. So it's critical that people like Yolanda, they need to educate us, you know, on how to get the word out, especially from an education standpoint. How do we get in the household? And you know, make sure people understand these things, because we don't know. Like, we just simply don't know. We try to guess, but asking the person who's actually there is the critical part.
So we need more Yolandas.
More Yolandas.
Well, maybe
yeah.
not. She might just be enough. I'm wondering if this girl isn't enough. And Yolanda, your story is powerful. You are powerful. I have a feeling you're going to be wearing your TV shirt a lot more often in the future. So keep that handy, keep it dry clean, keep it steamed. It's got to be ready for you. Because I think if you start with this mission and opening this center, we're going to be hearing a lot more from you, and we really appreciate that. Thank you for sharing your story. What do you want people to take away from our conversation with you today?
Don't give up hope and think that your future is so bleak. Get that second opinion, and very soon, probably after this broadcast, the university gonna say, hey, Ms. Irvin, come on over here and just work with us. We're just gonna make sure that you have everything you need. But we want the Hope Center, which is clearly healing opportunities for people everywhere, to be such a common thing that in my community, they'll say, what do I do, Ms. Irvin? What do I do? What do I do? Come on over here and let me show you what you can do. And then let me help you to get it done.
And Yolanda, I think when people come to your center, you're going to be able to turn to them and say, hey, I've got this. We've got this.
I might have to put that on the wall. You got this.
That's going to be your slogan. That's the slogan. I love it. I love it. Well, you are a friend of the health system. You will be back. Thank you so much for sharing today. Stay in touch. Thanks to all of our guests, all of our viewers. Have a fantastic weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update, brain surgery couldn't remove all of Lisa Webb's tumor, so she became the very first adult patient to get proton therapy at the University of Kansas Cancer Center. I'm Jessica Lovell. On the next Morning Medical Update, we ask, where are they now, and check how Lisa's life has improved 1 year after finishing proton treatment. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.